This presentation will discuss South Asian Indian culture and how to provide culturally sensitive nursing care across the lifespan. The PowerPoint was created by Angela Esposito, Kara Reed, Morgan Ross, and Kristen Seibenhar for Nursing 480 at the University of North Carolina, Wilmington. The U.S. is a nation with a rich cultural background. As the U.S. Census Bureau website states, currently 29% of the population consists of minorities, and this number is set to double or triple by 2050. As the ethnic and racial diversity in the U.S. continues to change, it will be important for the medical community to evolve and adapt to provide culturally competent health care. By focusing on and studying one particular cultural group, such as the Asian Indian culture, healthcare providers will develop a better understanding of that population's traditions, experiences, cultural sanctions and restrictions, health-related beliefs and practices, and values. Understanding patients' cultural needs allows nurses to provide more specific and unique patient care. As healthcare providers, we must be able to combine the best medical practices with individual beliefs in order to obtain the best outcomes. South Asian Indians have a variety of different healthcare beliefs. Ayurveda is a Hindu science of longevity. It states that all diseases are caused by an imbalance and that there should be a balance between the spiritual, mental, and physical well-being of each individual. Diet is very important, and some foods and medication may be considered hot or cold. It is important to reassure the patient that medication is not too hot or strong. Hindu Asian Indians may explain karma as a reason for illnesses and unexplained catastrophic death and disability. Self-treatment is very common, and patients will often consult family and friends prior to seeking medical treatment. This is more common for low morbidity conditions and stigmatizing conditions such as psychiatric conditions and sexually transmitted diseases. Complementary and alternative medicine is believed to be better and more effective for chronic conditions. Other popular treatments include herbal and natural medications, massage, diet, nutrition, and lifestyle changes. It is important for healthcare providers to inquire about different treatments because some of the herbs and natural products imported from India could contain heavy metals and other impurities. Asian Indians are also a very diverse cultural group. They speak more than 20 different languages and practice many different religions. Now we will discuss nursing implications related to specific developmental groups across the lifespan. When discussing the topic of childbearing women and their families within the Asian Indian culture, it is important to know that prearranged marriages are fairly common. Childbearing is also strictly confined to marriages only. Couples are expected to start a family immediately because it is believed children are crucial for fulfilling life. Becoming a mother elevates the woman's status within the community. There's a strong male child preference, and elderly women play an important role as a source of knowledge for new mothers. It is believed that dietary indiscretion by the mother will cause sickness in the newborn. Indians believe in the hot and cold system. Pregnancy is a hot state, so hot foods such as high protein, acidic, and salty foods will be avoided until the end of pregnancy. Post-pregnancy and during lactation, mothers are in a cold state and need to avoid cold foods such as sweet foods, fruits, and vegetables. Indians have a strong ritual pollution concept. Mother and baby are considered to be polluted and can only be touched by the birth attendant, the grandmother, and the mother-in-law until the umbilical cord falls off. Purification rituals are performed after birth. Due to pollution beliefs, new mothers are then confined for 90 days after delivery, putting them on bed rest instead of the typical Western medical practice of early ambulation. Ritual baths can be performed on newborns up to 3 months after birth. A black dot may be applied to the newborn's forehead in order to ward off evil spirits. Oil massages may be given to improve strength and maintain health. If breastfeeding, new mothers consider colostrum to be harmful and impure and will give the newborn hot water, sugar water, honey, or mustard oil, tea, or cow's milk to cleanse the system before breastfeeding. Circumcision is also not commonly practiced. Nursing implications for childbearing women and their families relate to confinement practices such as bed rest and also the hot and cold system that they believe in. New Asian Indian mothers will discard colostrum or delay breastfeeding until thinner milk is produced. They believe that colostrum is harmful to the newborn. Education from healthcare providers and lactation consultants is important to emphasize the benefits of colostrum. Nurses may observe prelacteal feeding, which is often honey. It is thought to protect the infant from illness. Honey is also used in the Jatakarma ceremony, where the father places a drop of ghee and honey on the baby's tongue and whispers of God in his ear, welcoming the new infant and protecting the baby from illness. Unpasteurized honey has a risk of botulism and should not be given to infants less than 1 year of age. The healthcare provider can suggest sweetened water flavored with herbs or sugar water. The Aranjanam practice involves tying a black string around the infant's abdomen to ward off superstitions of evil spirits. It can also involve lining the infant's eyes with black liner or painting a black dot on the infant's forehead. The black string has the potential of strangulation, and eyeliner should be discouraged due to the lead content produced in other countries. The healthcare provider could recommend to the parents for the patient to only wear the black string while awake and in the presence of the healthcare provider. Anaprasana is a ceremony at 6 months old to mark the intake of solid food. This food is specifically prepared for the infant. Some common Indian cultural remedies and potential health complications are listed in the table to the right of this PowerPoint slide. Differences between the Eastern and Western culture values shown in the table have the potential to cause mental health problems to the Indian, Asian, American youth. Studies have shown that adolescents have a high level of stress that might not be evident when observing them. Education is highly valued by the parents, and the parents will go through financial sacrifices and hardships for their children's education. A child's failure is considered shaming of the family. Conflicts also occur when the adolescent is being raised according to an Eastern culture while trying to develop their own identity and keeping their place in U.S. culture. All of these result in an adolescent that is reluctant to admit any problems for fear of tarnishing the family's positive image. These high levels of anxiety can be seen when looking at the high stress and suicide statistics among Indian Asian American youth. Studies have shown that 28% report depression, 19% report making a suicide plan, and 11% report making at least one suicide attempt. Healthcare providers need to be aware of the cultural differences and work around them, recognizing that physical complaints might be mental distress, but the patients are unwilling to talk about it because of fear of family shaming. Define and clarify the meaning of the presenting complaint. Asking any specific questions regarding psychological or behavioral problems should be posed carefully to elicit important information while still having respect for the patient's culture. The vast majority of Asian Indian adults practice Ayurvedic medicine, which is a belief in the balance of physical, mental, and spiritual well-being. Hinduism has a firm belief in karma and feel that illness is caused by past behavior and health is related to the connectedness of mind, body, and spirit. Nursing implications specific for adults aged 18 to 64 within the Asian Indian culture include knowing that same-sex providers are preferred for care. Direct eye contact from women may be limited. Privacy is very important, and patients must be covered at all times, exposing only the body part needed with family members present in the room. Nurses and healthcare providers should not remove necklaces or dots, and if homeopathic medicines are preferred, they should explain all medications and why they are necessary. The Hindu majority is vegetarian and will not take medications including insulin, which is made from animals. Mental illness is stigmatized and may present as somatic or physical complaints. Lastly, narcotics are also discouraged. Common health beliefs, historical experiences, and health practices help to shape how nurses and healthcare providers care for older adults aged 65 years plus within the Asian Indian culture. Common health beliefs include Ayurveda, karma, the possession of the evil eye, and preparation for afterlife. Historical experiences include how the British ruled, preventing non-farming casting families from owning agricultural land, promoted many South Asian Indians to move to the U.S. West Coast, and now many elderly individuals are still coming to the United States. Health practices include fasting and religious diets, which exclude the consumption of pork or beef. Nursing implications related to caring for Asian Indian older adults include knowing that an interpreter may or may not be needed, that modesty is important. Healthcare decisions are discussed with the family, however, the men tend to make the final decision. Family members tend to want to stay with and participate in care for hospitalized patients. Providers may be expected to take more of an active role, whereas the patient may take on more of a passive role. Mental illness may present as somatic symptoms due to cultural stigmas. Counseling as a form of treatment may not be openly accepted. Open expression of pain may not be common, so you'll need to pay attention to verbal communication. End-of-life considerations include knowing that family members may not want providers to tell the patient about their terminal diagnoses. Patients may prefer to die at home or die on the floor due to the belief that the floor is closer to the earth. Family members usually care for the dying patient instead of utilizing home health or nursing home services. Family may want to wash the body after death to prepare for cremation. Priests may perform religious prayers or blessings. Religious practices are specific to the type of religion, such as Hindu or Muslim. Organ donation or autopsies may not be accepted by the family. And an outward display of grief after death is common throughout this cultural group. When discussing Asian Indian communities, it is important for healthcare providers to know that education may need to be provided regarding how the U.S. healthcare system works. Inequalities in access to healthcare in India are affected by gender, caste, wealth, education, and geography. The wealthy usually receive care, but others in need of treatment may go without due to the fear of cost. Teaching Asian Indians how the U.S. healthcare system works will help to alleviate concerns regarding seeking and receiving care. Health providers could also supply individuals with information related to available resources such as free clinics or sliding scale clinics within the U.S. Resources related to the Affordable Health Care Act would also be supportive. It is important to understand the Indian familial structure. Multiple generations of Indian families typically live in the same household. The older generation is dependent upon the younger generation for both physical and financial care. Understanding the delivery and division of caregiving can help providers develop a plan of care that is socially acceptable to Asian Indian patients. Many Asian Indians use traditional complementary therapies to enhance healing. Ayurvedic medicine is an system of healing that originated in India thousands of years ago. This type of medicine combines all aspects of health, including physical, mental, and spiritual well being. Providers should be aware of the benefits and potential risks of using holistic and herbal treatments. It is important to develop education that incorporates the Indian religions. Many Indians belong to the Hindu faith. Strict adherence to this religion can create medical issues based on the management of medical conditions such as diabetes, during fasting, or praying rituals. Also, faith practices could present dietary issues if a patient is in an inpatient setting and is expected to eat bland hospital food. The next two slides contain key points regarding nursing implications for the Asian Indian culture. The presenters of this PowerPoint would like the viewers to consider these implications when helping them to provide culturally congruent nursing care. Here is a list of the references used to create this presentation.